The Texas A&M Rural and Community Health Institute, or ARCHI, was created 20 years ago with one important goal in mind. How can we ensure that residents of rural and austere communities were healthy and had excellent health care?
What we committed to was to take the land-grant philosophy out to small-town medicine. Now, the land-grant universities were formed to try to take the science that agriculture and engineering was developing in the university and take it out to the people who were doing those things every day. So if you take that philosophy that says, in theory, we here at the university are examining those issues of safety, new technology, new diagnostics, new treatments, how do we take that out to small towns? As we got there, we discovered that, yes, there's a piece of that, but it's much less about the technology of medicine than it is about the delivery system of medicine.
I take my job a little bit more personal. I was born in this hospital. My physician is still here. My grandmother was a resident when she was alive in my nursing home. My role with ARCHI has been from a client where we utilize them for all of our peer review for our physicians, as well as worked with Moonshot and ECHO, various programs that they bring to try to help sustain rural health care.
Often rural communities have one or two healthcare facilities. If that facility stopped operating or did not provide good high-quality care, there aren't other options. One of the biggest commitments for ARCHI is to do what we can to make sure that those institutions are successful.
We will always need people who farm, who run our spaces for hunting and fishing. So there will always be a rural population. So whether you enjoy the leisure activities that get done out in small towns, or you drive across the country and might find yourself in a very isolated area, rural matters to all of us. What I'd hope ARCHI does is continue to look for the things that are threatening our small hospitals and not only help the small hospitals, but educate our policymakers about what they need so that we can keep those facilities open.
When we get bogged down and don't know what to do or where to turn, I think as a CEO, reach out to ARCHI. You never know. They may have a program that's already started, or you may have just identified something that is ailing half of Texas that ARCHI can then go after and help and give you some resources to maybe help you get a plan in place. We all have our own issues, but I don't think any of them are unique or isolated to just a hospital. It's just maybe I'm not facing that current issue you are today. We're not on an island. Rural healthcare is not an island. We're not in a silo of this hospital.
In rural healthcare, the challenges are there. They'll be there for the next 20 years. But ARCHI is strategically positioned in a great place to work with the other institutions and the Texas A&M Health Science Center to make sure for the next 20 years we continue to improve the health care in our rural communities.